Welcome to Chapter 2, Medical Terminology and Anatomy Review. CPT is copyrighted by the American Medical Association, the AMA. Fee schedules, relative value units, conversion factors, and/or related components are not assigned by the AMA. They are not part of CPT, and the AMA is not recommending their use. The AMA does not directly or indirectly practice medicine or dispense medical services. The AMA assumes no liability for data contained or not contained herein. CPT is a registered trademark of the AMA. The objectives for this chapter are word elements, diagnostic and procedural terms, and anatomy. Some basic medical terminology. PRN means pro rata, when necessary. Word elements. So word root, derm, O is skin, spleen, O is spleen. Compound words, some examples are cardiovascular. So cardio, heart, vasculo, vessel. Nephrolithiasis. Nephro is kidney or renal. Lith is calculus or stone. Prefixes are beginning of a word, such as tri for three or cyan for blue. Suffixes are at the end of a word. Ectomy means excision or surgical removal. Itis is inflammation. Anatomy is the structure of the body parts and their relationship to one another. Physiology is the function of the body and how the body parts work together to carry out their life-sustaining activities. An organ is multiple tissue types formed together to perform a specific function for the body. The human body contains multiple organ systems. An example of an organ would be the heart. An organ system is a collection of body parts that depend on one another to achieve a mutual objective. An example of an organ system is the cardiovascular system, where the heart and the blood vessels work together to carry blood and oxygen to all the body cells. The organ systems make up the human body. In this chapter, we will discuss a brief overview of the organ systems. Each organ system is also discussed in subsequent chapters as it pertains to that chapter. The anatomical position. Healthcare personnel use a standard form for body directions and orientations. The standard body position is considered the anatomical position. The anatomical position is an upright, face-forward position with the arms by the side and palms facing forward. The feet are parallel and slightly apart. This position is used when talking about directional terms in medical documentation. In this medical documentation, it states the resection was from the superior portion, which is towards the head, down to the inferior portion, which is towards the feet. Understanding directional terms will help when interpreting medical record documentation. The integumentary system consists of the skin, hair, and nails. There are only a few procedures pertaining to the hair, so we will focus on the skin and the nails. These structures work together to provide protection from injury, fluid loss, and outside elements such as bacteria and viruses. They also help provide body temperature regulation, fluid balance, and sensation. In the CPT book, the breasts are also included in the integumentary system. There are two layers that make up the human skin, the dermis and the epidermis. Below the dermis is the subcutaneous layer. The subcutaneous layer is just beneath the skin and is composed of fatty tissue. The epidermis, which is closest to the outside of the body, has 4 to 5 different layers. And you have to know what those layers are. The epidermis, why does it have 4 to 5 layers? Well, the entire body has 4 layers, except for the palms of the hands and the soles of your feet. Those are going to have 5 layers to the epidermis. The dermis, which is under the epidermis, that will have 2 layers. So ultimately, there are 2 layers of the skin. The epidermis has 4 to 5 layers. The dermis has 2. A lot of people get confused and want to say the subcutaneous tissue layer is a layer of skin also, but for AAPC encoding purposes, it is not. The subcutaneous layer contains subcutaneous fat and arteriovenuses, and that's all hypodermis, below the skin, below the dermis. Here is an example of a CPT code from the CPT surgery section in integumentary. All integumentary surgery codes are going to start with 1s, and those are the 10,000 series. So if we were looking at 11042 in your CPT book, that says debridement, subcutaneous tissue, includes epidermis and dermis if performed, the first 20 square centimeters or less. And then there's a parenthetical that says for debridement of skin, example epidermis and or dermis only, the debridement 11042 subcutaneous tissue code is not your code. You need to go code 97597 or 97598. And those 2 codes are found in the medicine section of CPT. That's going to be your very last section in your CPT book. When we say medicine, we're not talking about medications. We're talking about a branch of study, a branch of medicine. I hope that makes sense. You can go back there to the medicine codes and just have a look to see what else is found there. The nail, fingernails and toenails, are made up of 6 parts. The root is the part that extends into the skin. The nail bed is the area the nail lays on. It extends from the lunula to the hyponychium. This is the pink part of your nail, which gets its color from blood vessels, nerves, or melanocytes. And melanocytes. The nail plate is the actual nail made of translucent keratin. The eponychium is the cuticle of the nail. The perinychium is the skin around the nail, and it is the site of hangnails, ingrown nails, and infection of the skin around the nails called paronychia. The hyponychium is the junction between the free edge of the nail and the skin. A term you'll want to be familiar with for nails is subungual. One word, subungual. That means under the nail. If we were to say subungual hematoma, that would be a collection of blood under the nail. Evacuation of a subungual hematoma is coded with CPT code 11740. The musculoskeletal system, sometimes abbreviated MS, is made up primarily of muscles and bones. It also includes the joints, the tendons, and ligaments. The bones form the skeleton, which supports the body, provides a mechanism for motion, and protects vital organs. The bones also serve as a production factory for blood cells and also stores calcium, phosphorus, and magnesium salts. The muscles provide form and heat for the body. Bones can be classified according to their shape. Long or tubular bones are longer than they are wide and are found in the limbs, such as the femur and the humerus. Short or cuboidal bones are shaped like a cube. Example of short bones include the carpal bones of the wrist and the tarsal bones of the ankle. Sesamoid bones are shaped like a sesame seed and can be found embedded in tendons in joints. There are two sesamoid bones in the ball of the foot beneath the big toe joint. The patella in the knee is the largest sesamoid bone. Flat bones have a layer of spongy bone between two thin layers of compact bone. The cross section is flat, not rounded. The skull and ribs are examples of flat bones. Irregular bones are the bones that do not fit into other categories of bones. Vertebrae have their own shape and are considered irregular bones. The vertebrae are the bones found in your spine. Cartilage is a type of flexible connective tissue that is non-vascular, meaning it has no blood vessels. Cartilage is a matrix made up of chondrocytes, collagen, and cells called proteoglycans, depending on the type of cartilage. Joints and articulating surfaces are synonymous and provide a connection between two or more parts of the skeleton. Joints are classified according to the type of connective tissue at the articulating surfaces. The three types of joints are fibrous, cartilaginous, and synovial. Most joints, however, are synovial. The human skeleton is divided into two parts, the axial skeleton and the appendicular skeleton. The axial skeleton consists of the skull, spine, ribs, sternum, sacrum, and they protect your vital organs. The appendicular skeleton is your extremities and the girdles that connect them. So extremities, arms and legs, and then where those connect to the body. So arms are going to be connected to the body by the shoulder or the shoulder girdle. The legs are attached to the body at the pelvis or pelvic girdle. Muscles have the property of contractility. They also provide form and produce heat for the body. There are three types of muscles. Skeletal, also called striated. These muscles are going to help move the skeleton. They are attached to the skeleton by tendons. Cardiac muscle is the heart muscle. It is an involuntary muscle that helps pump blood throughout the body. Cardiac muscle is also found in the first few parts of the major vessels that come off of the heart. Smooth muscle is found in the walls of the hollow organs of the body, like the esophagus to move food through, the bladder to control urine flow, in your eyes, and also found in the walls of the blood vessels. The cardiovascular system is made up of the heart and blood vessels. The heart pumps to move blood throughout the body through the pulmonary circulation and the systemic circulation. The heart is composed of three layers: the epicardium, which is the outer lining, the myocardium, which is the main heart muscle, and the endocardium, which is the inner lining. The muscles of the heart sit in a fluid-filled sac called the pericardial sac. A pericardial window, which is described in CPT code 33025, is where an incision is made into the pericardium to drain fluid that has built up around the heart. There are three types of blood vessels. The arteries, A for away, is going to take blood away from the heart. The veins are going to take blood back to the heart. Capillaries are tiny, semi-permeable vessels that facilitate the exchange of fluids, oxygens, nutrients, and waste between local tissues and the bloodstream. A coronary artery bypass graft can be created by using veins or arteries. Like the cardiovascular system, the lymphatic system includes a network of vessels that transports fluids. The lymphatic system is important to our body's defense system and its resistance to disease. The lymph vessels and the lymph nodes collect excess fluid from the interstitial spaces and return it to the heart using a series of valves. Lymphoid organs include the spleen, the thymus, the tonsils, and the Peyer's patches of the small intestines. The respiratory system, which is also known as the pulmonary system, it includes the nose and the nasal cavity, the pharynx, the larynx, bronchi, and their smaller bronchioles, the lungs, and the alveoli. The respiratory system functions to swap carbon dioxide for oxygen. The gas exchange occurs through the permeable membranes of the alveoli, sometimes referred to as alveolar sacs. The trachea, as it comes down and splits into two, the split where that occurs is called the carina. C-A-R-I-N-A. You have to know that. So the trachea, when it splits into two, that split is called the carina. It will split into right and left bronchi, and then the bronchi move on into the lungs. The further away they get, the smaller these branches become, looking like a small little tree. These are called bronchioles. At the end of those bronchioles are the alveoli. What happens in the alveoli? The carbon dioxide is switched to oxygen. The digestive system is a feeding tube that begins in the mouth and ends at the anus. The structure winds its way through several body cavities. It encompasses a multitude of structures and organs that mechanically and chemically breaks down food for absorption into the bloodstream and for use at the cellular level. The esophagus joins the stomach at the cardiac orifice, so closer to the heart, right? Cardiac. The fundus of the stomach is the rounded upper portion of the stomach. The body is the main portion, and then the pyloric antrum is the lower portion of the stomach. So, if we wanted to, we could say at the top of the stomach, where it connects with the esophagus, that will be the cardiac sphincter. And then at the end of the stomach, where it connects to the small intestine, that is the pyloric sphincter. The small intestine is divided into three sections. The first 1/3 of the small intestine is the duodenum. The second 1/3 is the jejunum. And the distal 1/3 is the ileum. We know distal is farthest from attachment, and you have to know these. So DJ ileum, DJI. There is also an ileum in the pelvis bone. To easily remember which ileum is in the small intestines, remember all three sections of the small intestines are spelled with an E. So duodenum, jejunum, and ileum. So they all have an E in there, whereas the ileum in the pelvis bone is spelled I-L-I-U-M. The large intestine begins just after the ileocecal valve at the cecum. So what is that saying? That is saying the ileum, which is the ending of the small intestine, connects with the cecum, which is the first portion of the large intestine. At the end of the cecum, where it begins, the appendix is attached at the bottom. Then you have the colon to the rectum to the anal canal. There are 4 portions to the colon. You have to know these in order. The ascending colon proceeds from the ileocecal valve upward to the hepatic flexure. So flexure, there's going to be a bend there in the colon. What does hepatic represent? The liver. So the liver will lie on the right side at that bend, which is the hepatic flexure, which then becomes the transverse colon, which is going to cross across our body. And then it will turn downward to become the descending colon. Where does it begin to be the descending colon? Well, there's another bend, and that's there on the left-hand side. You're going to have the splenic flexure or colic flexure. Same thing, 2 different names. And what organ do you think lies next to there? The spleen. The descending colon gives way, which means it goes down to the sigmoid colon and ends at the rectum. Where that descending colon is going to have the bend, which goes into the sigmoid colon, there's a flexure there as well. It's a bend, right? So that is called the sigmoid flexure. Once we make it to the rectum, we have internal and external anal sphincters at the terminus of the rectum, which controls the flow of fecal material leaving the body. When coding for endoscopies of the large intestines, it is very important to know the extent of the large intestine examined. The endoscopy begins at the rectum. For a proctosigmoidoscopy, the examination goes into the sigmoid colon. For a sigmoidoscopy, the examination goes through the sigmoid colon and possibly into a portion of the descending colon. For a colonoscopy, the entire colon is examined. And for all of these, what tool are they using? Well, they're using an endoscope. The scope is going to help them visualize and see what needs to be done. The urinary system is primarily responsible for the production of urine for the excretion of metabolic waste, along with fluid and electrolyte balance. Structures of the urinary system include the kidneys, ureters, urinary bladder, and the urethra. The kidneys, how many do we have? Most people are born with 2 kidneys, the majority. There has been studies and surgeries where we've seen up to patients having up to 5 kidneys. We've seen studies where people are born with 1 kidney, or they're born with 2 and had to have 1 removed or something like that. Ureters. The ureters are going to connect to the kidneys, and we have 1 per kidney, and those are going to connect at the renal pelvis. Think of your legs. Where do they attach to your body? The pelvis. So where do the ureters attach to the kidneys? The pelvis. So the renal pelvis, the word is pylo, word part, Pyelo. Then we have the ureters come down to the bladder, and then the urethra and on out. Now, there are studies that show that people could be born with double ureters. And what that means is there's 2 ureters coming off each kidney, running down and connecting with the bladder. A urinary calculi, or stone, so kidney stone, can exist anywhere within the urinary system. The diagnostic and procedural coding are both dependent upon where in the urinary system the stone exists. The organs of the reproductive system differ greatly between male and female. However, their functions are similar. The male and female reproductive organs include external and internal genitalia. You need to know the external and internal for both. Because of the makeup of the male and female reproductive systems, the female is more likely to get a urinary tract infection, a UTI. Please also note that Skene's glands and Bartholin's glands are female specific. The Cowper's glands are male specific. If I were to say tunica vaginalis, what would you think? That was male or female? Well, the majority of people will automatically say that is female because vaginalis, right? However, we need to know that that is male specific. The testicles are held into a sac, the scrotum. Beyond this, if you go from outside to in, you have the sac, which is the scrotum, and then you have the tunica vaginalis. Think of it as a tunic, a coat, a cape. It is going to be around the testes to protect them. So make sure you know which one is female, which one is male, and so forth. The nervous system provides three general functions: sensory, integrative, and motor. The nervous system helps us to feel, think, remember, move, and be aware of the world around us. It is divided into two groups: the CNS, the central nervous system, and the PNS, the peripheral nervous system. The central nervous system is the brain and the spinal cord. The PNS are the nerves that attach the brain and spinal cord to the rest of the body. The cranial nerves stem from the brain, and the spinal nerves stem from the spine. The nervous system functions as a central operator and as the central intelligence for the body. It detects change outside and within the body, makes decisions based on the information received, and stimulates muscles or glands to respond. Organs of sense are classified as a subsection of the nervous system. The sensory organs receive and filter sensory input that is interpreted in the nervous system, the central nervous system. Organs of sense include the eye and the ear. The eye is the sense organ of sight. The eyeball is made up of three layers. The inner layer is the retina. The middle layer, the vascular layer, is called the choroid. And the outer layer is the sclera. The eyeball is separated into an anterior segment filled with aqueous humor and a posterior segment filled with vitreous humor. The crystalline lens separates the two segments. The aqueous humor is responsible for the intraocular pressure in your eye. The vitreous humor shares in the responsibility for the pressure, but also prevents the eyeball from collapsing. One of the most common procedures on the eye is actually on the muscles that control the eye movement instead of the eyeball itself. That is known as strabismus surgery, which is performed by shortening or lengthening various muscles of the eye. The ear plays a part in both the sense of hearing and the sense of equilibrium. The ear works in tandem with the auditory nerves to send auditory impulses to the temporal lobes of the cerebrum. These structures working together form the auditory apparatus. The ear has three distinct and separate anatomical divisions: the outer or external ear, the middle ear or tympanic cavity, and the inner ear, also known as the labyrinth. The auditory apparatus uses the ear to capture sound waves and transmits them or conducts them into the tiny hair cells in the organ of corti. Dendrites, the nerve endings of the sensory neurons for hearing, are found in the bottom of those tiny hair cells. The auditory canal, or eustachian tube, connects each middle ear to the throat. This allows easy transfer of infections in the throat to move into the ear, causing a middle ear infection. Children who have repetitive ear infections at an early age will sometimes have tubes placed in their ears. Otology is the study of the ear. This is a very specialized field of medicine. There are two types of services: audiometry and surgical. Surgical services are often performed by an ear, nose, throat physician, and the codes for the procedures are typically found in the surgery section of the CPT codebook. Audiometry services are studies to test and improve your hearing. These codes are found in the medicine section of the CPT codebook. Regulating functions of the human body to maintain homeostasis is accomplished by the nervous system and the endocrine system working together. They form a system of internal communication for the body. The endocrine system includes cells, tissues, and organs called endocrine glands. Endocrine glands are ductless glands secreting their hormones directly into the bloodstream. The hemic or hematologic system involves the blood. Red cells or red blood cells or erythrocytes, they contain hemoglobin that enables the cells to pick up and deliver oxygen to all parts of the body. White cells, white blood cells, leukocytes, those are the body's primary defense against infections. Platelets or thrombocytes form clusters to plug small holes in blood vessels and to assist in the clotting process. What are the 5 white blood cells? Well, the mnemonic I have that helps me remember is never let monkeys eat bananas. So never is neutrophils, let is lymphocytes, monkeys is monocytes, eat is eosinophils, bananas is basophils. So never let monkeys eat bananas. The immune system is classified as a separate system from the hematologic system. However, most immune cells originate in the hematologic system. Often the study of allergies will go hand in hand because an allergic response isn't actually an immune response. The immune system is made up of 2 types of cells, B cells and T cells. B cells are created and mature in the bone marrow. They get activated and produce antibodies that attach to the surface of the infectious agent. T cells identify infectious agents and directly attack them. Both T cells and B cells are different types of lymphocytes. Other types of white blood cells used by the body for protection include never let monkeys eat bananas, neutrophils, lymphocytes, monocytes, eosinophils, and basophils. And all of those are types of white blood cells, leukocytes. Antigens elicit an immune response in the body. Antigens that enter the body from the environment include inhaled macromolecules, for example, proteins on cat hair that can trigger an asthma attack, ingested macromolecules such as shellfish proteins that trigger an allergic response, or eating peanuts, which could trigger a peanut allergy. And then molecules that are introduced beneath the skin, such as on a splinter or in an injected vaccine. Antibodies are immune system related proteins called immunoglobulins, so Ig. Some antibodies destroy antigens directly. Others indirectly by making it easier for white blood cells to destroy the antigen. As you have heard in this lecture, it is imperative for a coder to know and understand medical terminology in order to be able to read and understand what is written in medical documentation. It is also essential for a coder to know and understand anatomy as it relates to medical procedures and diagnoses. Thank you for listening to Chapter 2, Lecture, Medical Terminology and Anatomy. Once you go through your chapters, if you feel there's some medical terminology or anatomy information that you do not know and it is not found in your code books already, please go ahead and be sure to make notes in your code books and write things in. You are welcome to write anything you wish in your code books. You just cannot write full questions. So if you shorten the question, and of course, if it's multiple choice, don't write all the choices, then you're good to go to write those in your book. I look forward to seeing you all on Lecture 3. Lecture 3 would be Intro to ICD-10 Coding. Thank you so much, and I'll talk to you soon.